This is the January 2024 TouchWorks education. There are some new order updates. Beyfortus, 100 milligram ml intramuscular solution, prefilled syringe will auto-charge code 90381 when administered. The Beyfortus 50 milligram ml intramuscular solution, prefilled syringe will auto-charge code the 90380 when administered. But the Vaxilis intramuscular solution prefilled syringe will auto-charge code 90697 when administered. Hold for auth has been removed from the following orders. The Memorial Cardiac Rehab Phase 1. Use the new SIU-only Cardiac Rehab Phase 1. The Memorial Cardiac Rehab Phase 2. Use the new SIU-only Cardiac Rehab Phase 2. The Memorial Cardiac Rehab Phase 3. Use the new SIU-only Cardiac Rehab Phase 3. And the Power Mobility Evaluation. Hold for auth has been removed and financial auth needed has been added to the following orders. The X-ray UGI with air contrast small bowel follow-through. The PT aquatic/land therapy. Request for services, registered dietitian and certified diabetic educator. Hold for auth has been removed from the following orders for all non-FQHC sites. The MC/MSC only bone density, use bone density 77080. The MC/MSC only colonoscopy, use the SIU only colonoscopy. The MC/MSC only PT evaluation and treatment, use SIU only physical therapy evaluation and treat. The MC only early intervention referral, use the SIU only early intervention referral. The cath cardio only. Yellow required questions for requested procedure has been added. The following yellow required fields have been removed: admission status, allergies, and social security number. On the home health order, type drop-down defaults to home health. New orders. The following new SIU only cardiac rehab orders should be utilized instead of the previously available orders listed above. SIU only cardiac rehab Phase 1, SIU cardiac rehab Phase 2, and the SIU only cardiac rehab Phase 3. Inactivated orders. The following orders have been inactivated in TouchWorks: the referral gastric bypass evaluation and the transplant consultation. New interface documents. Transition of care note, beginning 12/19 of 2023. This will be a new document type available in Cerner that will interface to TouchWorks. This will not generate a task and will be indexed under the hospital miscellaneous. There are two new allergies that have been added. Honey has been added as a non-medication allergy, and the preemie skin closure has been added as a non-medication allergy. New document types. The SEMG uroflowmetry is a new scan document type that will be placed under procedures in the basic chart order. Text templates updates. Medical imaging text template updates. In the MHCT scheduling, optional question has been added. Does patient have an Infusiport? In the MH diagnostic scheduling, the optional question has been added: if screening, date of last test. MH MAM scheduling, the optional question has been added: if screening, date of last test. Tasking, new generic users. Appointment request and referral request generic users have been created for each document. Each department. A list of these generic users is attached. These are the generic users that should have tasks sent to them for appointment request and referral request. For For the referral request generic users, the Patient Access Center will send a task to these generic users when a referral appointment is needed for an area in which they are unable to schedule or a sooner appointment is needed. For the appointment request, any appointment request should be sent to the generic user when an appointment is needed for a patient. If the appointment request is a result of an external referral request or document received from the outside location, be sure to include the task Add TC SOC in the scheduling comment of IDX. SIU only adult visit update. Head circumference has been added to the SIU only adult visits. Pregnancy diagnosis codes to auto-resolve. The following pregnancy-related diagnosis codes will now auto-resolve after the time frame indicated below. These will not be retroactive and will only apply to codes added after the 1/3 of 2024. Please see attachment for list of codes that will be impacted. TouchWorks Tuesday tip. Beginning in January 2024, the clinical informatics team will provide TouchWorks Tuesday tips. The TouchWorks Tuesday tips will be sent out via email and shared with users by CI staff when rounding. If you have a suggestion for a tip that could be useful to other TouchWorks users, please email CI Central at siumed.edu with your suggestions. Telehealth note updates. With the extension of the public health emergency flexibility for telehealth services, there have been some changes to the current telehealth note form. The following updates are telehealth statement updated to only read, telehealth visit should include video. Removal of beginning January 2024 to perform telehealth from home. Your home address must be credentialed with insurance company. The removal of virtual supervision of residents is not permitted unless located at an appropriate site. Audio only statement updated to, if using audio only, this visit may not be billable service. Please indicate below why audio only was used. If you have questions about charges or extension details, please reach out to Laura Kessel. Lifestyle prevention recommendation orders update. An option to view the criteria that must be met for the CT low-dose lung screening has been added. Select the bubble to review the specifications. Follow My Health at SIU Medicine message options. My Health at SIU Medicine message option job aid is attached. The job aid outlines the steps necessary for the below task to be generated. There are 2 new options available with FMH patient message, FMH not read receipt. This is a task that can be system generated if the patient has not read a message by a certain date or time. Notify complete. This is a task that can be system generated if the patient does read their patient message. DMH cardiology scheduling process. Please see the attached job aid for scheduling cardiovascular services at Decatur Memorial Hospital. This only applies to DMH at this time. ICD-10 additions. Notification was received from the MSO that there were missing ICD-10 codes in TouchWorks. These codes were added to production on 12/14 of 2023. Please see the attached list of ICD-10 codes that were added. There are some code additions and updates. Also see attached list of codes that were activated effective December 31 of 2023. An activated CPT code charge edit job aid is also attached. Inbound document workflow changes. Beginning January 17th of 2024, The workflow regarding documents received electronically from outside sources will be updated as follows. For the FQHC workflow highlights, all non-pharmacy documents received from outside sources such as HSHS St. John's and Springfield Memorial Hospital will be saved to the patient's chart, and a Verify External Doc task will be sent to the provider. The provider will be responsible for reviewing the document and determining next steps needed for continuity of patient care. The provider will verify the document that was received and communicate with clinic staff next steps needed. If an appointment is scheduled, TC/SOC needs to be added to the scheduling comment field in IDX. All pharmacy-related documents from outside sources, such as Walgreens, Express Scripts, Optimum Rx, will be saved to the patient's chart, and a Verify External Doc task will be sent to the provider's nurse task list. The clinic staff working the nurse task list will be responsible for reviewing the document and determining next steps needed. The clinical staff will verify the document that was received and add any information received into the patient's chart, such as immunizations. If an appointment is scheduled, TC/SOC will need to be added to the scheduling comment field in IDX. For non-FQHC workflow highlights, all documents received will be saved to the patient's chart, and a Verify External Doc task will be sent to the provider's nurse task list. The clinical staff working the nurse task list will be responsible for reviewing the document and determining next steps needed. The clinical staff will verify the document that was received and add any information received into the patient's chart, such as immunizations. If an appointment is scheduled, TC/SOC will need to be added to the scheduling comment field in IDX. If a provider input is needed on the contents of the document, an appropriate next step, always verify document before performing this step. Send a separate task to the provider with the document detail requesting next steps. Do not reassign the Verify External Doc task to the provider. The Verify External Document task job aid is attached as well.